Welcome to the 6th podcast of the Merseyside Pensioners Association, recorded on the 22nd of April 2020. It's not just for pensioners, but for everyone. In today's programme, we examine why the care system is not fit for purpose and contributing to the deaths of thousands of pensioners in the UK. We talk to a senior nurse practitioner, daily putting her and her family's lives at risk, who reveals the human costs of bankrupt health policies. We listen to the Government Health Secretary, Matt Hancock, lie about PPE. Again, we listen to the damning analysis of government policy by Professor John Ashton. We reveal the political love affair between Boris Johnson and Donald Trump. We hear from the chair of the MPA, Julie Lyon-Taylor, who tells us why she's so angry about the way cleaners are treated. On the brighter side, we will be hearing music played by Merseyside pensioner Phil Newton and hearing the confession of a Merseyside pensioner who is the pen pal of Boris Johnson. We start today's programme with the incredible words of the Prime Minister in waiting, the vacuous Matt Hancock. This is Merseyside pensioner Phil Maxwell saying, "Do you remember listening to this?"
Everyone working in a critical role must get the PPE that they need. In normal times, the NHS supply chain for protective equipment supplies 233 hospital trusts. Right now, 58,000 separate health and care providers need PPE. So we've had to create a whole new logistics network, essentially from scratch. All of these challenges around supply, around usage and distribution are being overcome. There's enough PPE to go round, but only if it's used in line with our guidance. We need everyone to treat PPE like the precious resource that it is.
Mr. Hancock should start to understand that the most precious resources we have is the dedicated men and women who are putting their lives at risk daily in order to save the lives of NHS patients. In his statement to Parliament on January the 23rd, Mr. Hancock said the UK is one of the first countries to develop a world-leading test for the new coronavirus. In terms of pandemics, he said, we are well prepared and well equipped to deal with them, and that the public can be assured that the whole of the UK is well prepared for these types of outbreaks. Let's now leave the fantasy world of Mr. Hancock and talk to an actual nurse who lives in the real world. So what has your week been like?
Personally and professionally, it's been just a very tough week. I think it makes it worse when I'm probably doing what I shouldn't be doing, which is watching the TV every day like everybody else is, and watching the sort of half-truths and the lies that are being told at the podium every day. And, we're being told all the time that we're all in this together. And I just want to shout and scream and say, no, we're not. We're not in this all together. And, it's still that question of the PPE, the personal protective equipment, which is still coming up there. And the government this week have actually admitted there is not enough PPE. After we were told, yes, there was. It was just a question of getting the stuff out to you. Now, you've got the position now where, even when I was listening to the radio this week, a chief executive from a trust that wouldn't be named said they're running out of their equipment by this weekend. And they are looking after patients with COVID-19. I think we're being told half-truths. We're being told lies. I mean, the official figures, I think, at the moment are that there's 27 healthcare workers have died. In actual fact, there's 88. There's more than that. And I think because of this lack of PPE, And I'm upset because I've got lots of friends who are looking after patients with COVID. I might be looking after patients with COVID-19 myself, and I don't know that they've got it. But because that lack of PPE is there, you know, some of those nurses and doctors are going to be patients themselves in about 3 weeks' time.
Yeah.
I mean, it just upsets me to talk about it. 2 brand new mums who are both healthcare workers who have both died. They're never going to see their child grow up. And I think it's more than tragic. I'm sick to death of being patronised and being condescended. It's more than that. For me, it's corporate manslaughter, because these children are now going to grow up without a parent. And the government is culpable. They knew back in January that they didn't take enough provision. They didn't do what the World Health Organization was telling them to do. You know, Boris Johnson, you know, all these COBRA meetings, these big strategy meetings, he didn't turn up for most of them. You know, there was no lack, and I think there was actually a real arrogance about it to say, oh, this thing is never going to happen. It's never going to happen. Well, it did. The World Health Organization said, if you've got COVID-19, you must have the proper equipment. You must have the gloves, the gowns, you know, the visors. Now we're being told, you know, you'll have to wear those gowns in between patients, ones that can be rewash can, and even single-use equipment. They're now being told that they've got to use it again because they're just run out. I mean, I think it says a lot when, I mean, I'm just a mere nurse, but when a chief executive comes on the BBC and anonymously says, we haven't got enough PPE and our staff are being put at risk, I just think it says, you know, that's the truth of it all.
So can we be clear about this? Is NHS England following the advice of the World Health Organization?
They certainly are not. Not in my mind. The World Health Organization, I think, has been the most credible, authoritative body on every epidemic and pandemic that we've had. And they were telling our government back in January, they were raising alarms then, and our Public Health England and our NHS England chose to water down, or the government, they were told about it, they tended just to dismiss it. And I think actually Boris Johnson said, you know, it's just going to be another flu epidemic, which clearly it wasn't. So they're not following those sort of guidelines for me. And I think it's, you know, for want of a better word, I think it's criminal. Why would you not listen to the most authoritative body? Why would you listen to a government who is just relying on its own scientists? And for me, I have to say, well, hang on, they're only listening to the scientists that are giving them the answers that they want. There was a guy called Professor John Ashton. He was on Question Time a couple of weeks ago. Yeah. He was actually saying, he used to be the public health, the regional director of public health in the Northwest many years ago. And he was the guy that was always banging on and saying, here is the connection between ill health and poverty. It goes back as like the Black Report from the 1950s and 60s. Yeah. And he was ignored. He was always regarded as being, oh, that's just Professor John Ashton. And I remember somebody saying to me, he'll never become the director of the public health in England because he speaks his mind and he speaks the truth.
Well, let's just listen to what Professor Ashton had to say.
I don't know where to start, really. I mean, I'm embarrassed by the situation in this country. You know, this talk of 4 stages, and we're now, you know, moving on from the containment thing. We've lost the plot here. We haven't taken the action that we should have taken 4 or 5 weeks ago. Boris Johnson should have convened COBRA at the outset when it became clear what was cooking up. Countries that took firm action at the time, if you look at what's happened in Hong Kong and Singapore, which had a lot of cases initially, but which took firm action, and they've got the thing under control. We've lost control here. Last night, I didn't go to Anfield last night because, I had such second thoughts about it. 3,000 supporters came to Anfield last night from Madrid, where they're playing football behind closed doors. The virus is around in Madrid. We've had that virus has been shared around Merseyside last night in the bars and clubs of Merseyside. The virus is no doubt now among us for reasons which are totally obscure to me. We've taken it as policy not to track the people who've come back from Italy, not to test the people who've come back from Italy. So the virus will now be amongst us. And the government's approach has been paternalistic, it's been old-fashioned, it's been top-down, and it's not done what needs to happen now, and we've lost 4 or 5 weeks, which if we get the epidemic that looks like happening, then it's going to be a community issue to be dealt with by the community. We've had a very narrow, technocratic approach, which has not got its head round the social dimensions of this. We learned nothing from Ebola. In Ebola, in 2014, we lost 3 or 4 months because we took a narrow science base to this. We've got to achieve cultural change here, and that cultural change can't be done to people, it's got to be done with people. Okay. The closure of grounds, the closure of schools will need to happen. It should be done on an informed basis, depending on where the cases are. The government's failed to divulge the information that the public needs to know whether their area is one where they need to start taking action or not. We've been kept in the dark. Okay. 50% of the population now goes to university, and they're being treated like peasants. And it's time we had a change of approach.
And then I read in the Echo this week that one of the bars that they all went into, the pub manager from, I think it's the Beehive, passed away from the coronavirus this week. Everything he said has absolutely comes true. He said you have to do the contact tracing. You have to test.
Can I just ask you there, have you been tested?
I've not been tested, no. They are rolling out some tests now.
Yeah.
But the tests themselves are swabs. They're only about, and this is, from my colleagues that have told me, they're only about 70% effective. So you could actually get somebody who would test as a negative, but they've got all the classic symptoms of COVID-19, and they may well be in hospital or in the intensive care units now. And the clinicians are making that decision that they've got COVID-19, even though that the swab is telling them that it's false. I know personally of somebody that was told that their swab was negative, and yet was fighting for their life 2 weeks ago. A fairly young, healthy individual. So no, I mean, you'd have to say that the tests themselves are not 100% by any means. I mean, I will tell you this is a 27-year-old who's just died in London. She was a care home worker, one of our underpaid, undervalued members of society. She's left a 3-year-old girl. Well, that's happened in the care home. I haven't gone into it now, but I'm thinking, hang on a minute, why aren't we using universal precautions for everybody? Because when I was reading some stuff the other day, and I was reading it came out of China by some of the researchers over there, and they are actually saying that patients with COVID-19, they're infectious before they're having symptoms. So, all of the people that are going in the care homes and working in the care homes or working in the community or working in the hospitals, they could actually be treating people without any proper PPE on. And those patients are asymptomatic at that time, but they're still positive.
It seems as if the government has ignored care and nursing homes.
Absolutely. I mean, I think I spoke to you last week before Matt Hancock made the announcement of we're going to start counting in the figures. Well, I think I spoke about that on the radio, saying they're not counting the figures in, and now they've actually said that it could be 4,000 plus. I think it's probably more. I don't know. I'm not a statistician, but the Office of National Statistics, which I think one of the things he said is it was very difficult to get the actual figures. I've just never heard such bawling all my life. We've got infection control people everywhere around in primary and secondary care. So it just didn't wash that they couldn't get the accurate figures, and the figures in the hospital are more.
Well, in terms of the so-called accurate figures, the up-to-date figures, until the 3rd of April, only 217 care home COVID-19 deaths had been officially recorded in England and Wales.
Yeah, but they're not swabbing anybody in the care homes. They've only taken that decision this week. So we've already lost quite a number. And at the end of the day, even a cause of death is a medic's assessment of the situation.
Yeah.
It's an assessment. It's in their opinion, this is how this patient has died. Now, you know, if somebody is frail and elderly and they've taken off very quickly, and doctors are being told, don't put COVID-19 down as the cause of death, where's that coming from? It's almost like they're just trying to blank the figures. But for me, the figures are startling now. I mean, we're 16,000 now, and that's just of hospital figures alone. We are, 88, I'm not seeing the figures today, of healthcare workers. Well, there's healthcare workers in every setting. We've got people who are looking after their own families. They mightn't be paid healthcare workers, but they're still looking after the health of their families. There's been 10 nurses suspended in California because they refused to care for patients without the proper equipment. And what a horrific dilemma that must be for any healthcare professional, because I think most healthcare professionals, like myself, would say, of course, we'll go and help someone because you put your patients first. But what a lot of health workers are not going to do now is put their own families above themselves. And the dilemma is going to be for healthcare staff is, do they go and look after people with COVID-19 and take a risk that they're going to bring that disease back into their own family?
Yeah.
You have to say, and we've got to be honest here, are you going to put your family at risk? Not yourself, but are you going to put your family at risk? And I think that our government has put healthcare workers in the most untenable position here. I really do.
Well, it's the job, isn't it, of the health and safety executive to ensure that workers are protected. But it appears that the government is prepared to just ignore all health and safety regulations.
It's like they've ignored the warnings from the World Health Organization. And for me, I just feel now, when I turn the television on, I'm being patronised by so-called experts and scientists who are standing next to government ministers, and it's almost like they've become stooges to the government. That's all I can say.
Well, I wonder if they would go into care homes and swab residents.
Absolutely. I just think now, I totally agree with you. Would they go in without any protective equipment on, or anything? No, I don't think they would. And I think in this crisis now, many more deaths could have been avoided if we'd had that PPE. And Matt Hancock is now defending his order about reusing PPE and single-use equipment. He tried to blame health workers a few weeks ago by saying people were using them inappropriately, and he got such a backlash over it. So he's withdrawn on that. I think nothing has been coordinated with any haste. And, as I said before, the Prime Minister didn't even turn up to half of his COBRA meetings. There's been numerous firms and individuals who've offered to make the equipment. And you read of it every day and you hear of it every day, of small and medium-sized firms that are saying, we will make the masks, we will make the long-sleeve gowns for you. And nothing has happened. Instead, what the government has done is it's given orders to the people who donate to the Tory funds, like Burberry. If I hear Burberry once more, it appears like they're the only company in Britain that's offered to do anything. But Burberry, F1, and all of those big companies, they're all big donors to the Tory party anyway. It's almost like, well, we'll sort our friends out first. And I'm just furious. I want to weep and I want to shout and scream and just say to people, this is what's going on. I watched that 100-year-old gentleman this week who did that, kept walking up and down his garden, and he's raised 23 million, which I think is, for him personally, what an achievement, but what an indictment on our government that we're having to rely on an elderly gentleman to raise 23 million. It's an absolute disgrace. We've had 2 new mums die who were never going to see their babies, and yet the Public Health England, and the advice is for pregnant women to stay at work. And I think it's so wrong. We don't understand how this is. We don't understand fully the transmission of it. We are putting pregnant women at risk. Those women should be sent home, and they should be sent home on full pay. There should be no question about it. I'm pretty sure, members of the royal family and, members of the Tory party, if they're pregnant, will be getting very well looked after. But we need to look after our pregnant women who are working, not just in hospitals, but in every area of society. That we should be protecting them and their babies. I'm getting really angry now.
Tony Benn once observed that, quote, making mistakes is part of life. The only things I would feel ashamed of would be if I had said things I hadn't believed in order to get on. Some politicians do that, end of quote. The people who govern, supposedly in our name, are lying through their teeth over the numbers of COVID-19 cases and deaths in the UK. They're lying about their plans for testing and the delivery of personal protective equipment. They're lying about the production of ventilators and PPE. The rising COVID-19 death toll of pensioners is exasperated by our failing and inadequate social care system. Earlier, I spoke to Merseyside pensioner Anne Bannister. Anne spent many years in local government as a specialist in social care policy. I asked her if the care system was fit for purpose.
It's absolutely not fit for purpose, and it has been for decades, really. The whole social care system is underfunded, undervalued, and one of the major problems is that it's essentially run by private businesses. But just to take the care home sector itself, that 83% of beds are in the private sector, only 4% from local authorities, and historically that's been the case really since the set up of the National Health Service, that so that the care sector has been run for profit, not for the needs of individuals. And over the last few years, the last 10 years, there's been absolutely drastic cuts in the amount of funds that are available from local authorities to fund social care, such that before we started the pandemic, that it was £7 billion a year was needed just to bring it back to what it was 10 years ago. So we started this crisis with total underfunding and total undervalue of the care workers, who are essentially on the minimum wage and being, have to deal with the most unbelievable crisis in the care homes once the virus gets in, that they're having to effectively nurse, without being nurses, people to the end of their life with very little support. Merseyside pensioners have been supporting Reclaim Social Care, which is a national campaign that has been set up to call for the social care sector to be fully funded, to be based on that care should be provided free at the point of need, in the same way that the health service, that care workers should be have a decent wage, a career structure, and not be left in poverty wages, that the care should not be in the private sector, that it should be publicly provided care. So social care, the way it is run at the moment, for example, that care homes, many of them are owned by the big companies, and they're at the core of the hedge funds, where they're run at the moment on the basis that they have to provide a profit of 12%, much more than most other industries, in order to feed the hedge fund. Many of them are built on the basis of private contractors building these establishments, and with the care that is provided in them. They maybe look absolutely wonderful, but the care that's inside is of the minimum quality. And if we're going to have a care sector that is going to meet the needs of individuals, it has to be democratically run. It has to be for the people. It should be local authorities are in the best position to actually provide the infrastructure for social care. And one of the things that I'm saying at the moment, this is an individual point of view, is that if we're going to get through this crisis, that the care sector should really be taken over immediately by local authorities, because why should you continue to provide the care if you're not going to make the profit? And at the moment, why should anybody go and do the job that care workers are being asked to do if it's only for profit? It has to be on the basis that it's done for the needs of the community, of the people. And care homes shouldn't be these huge establishments. In America, you're talking about 100 and 150 bedded units, and we're seeing that huge numbers of people are dying in these establishments. And in my own local area, they're talking about a care home being, not care home, extra care facilities of 90 plus apartments. So you can imagine, once a virus gets hold, how the numbers of people that are going to die in those establishments. They should be small, local run, part of the community, where that local authorities should own them, but it should be community run for the best interests of the people, where they can stay where they had their original homes, that local community will be involved in the running of it, and that home care and residential care should be an easy transition from one to the other, so that people feel they're still part of the community and not dumped in some skyscraper with no involvement of seeing the rest of society around them.
Let's take a break now and listen to musician and Merseyside pensioner Phil Newton.
Hello Phil again here in the garden. I might be in competition with some other wind instruments for this tune Take 5 by Dave Brubeck. No, it was written by his saxophone player. I can't remember his name.
Thanks for that, Phil. We heard earlier that Boris Johnson failed to attend crucial Cobra meetings. We now know that between February the 13th and March the 30th, the UK missed a total of 8 conference calls or meetings about the coronavirus between EU heads of state or health ministers, meetings that the UK was still entitled to join. The government missed a deadline to participate in a common purchase scheme for ventilators, to which it was invited. Ventilators that are vitally important to treating the direst cases of COVID-19 have fallen into short supply globally. Johnson's spokesperson blamed an, quote, administrative error. The actions of the UK government have had tragic consequences for thousands, and who knows where it will all end. What is clear is that the ineptitude, procrastination, and a total lack of transparency has magnified the scale of damage the pandemic is inflicting on the population. If you use your lockdown free time to pleasure yourself by watching the BBC News channel, you would have seen yesterday at the bottom of the screen the breaking news that the PM had a phone call with Donald Trump. Because breaking news from the BBC is, in fact, broken, no details of the nature of the call were given. Perhaps in 30 years' time, our secretive government will reveal a redacted version of the call. Of course, by then, if the world economy continues on the same path, we'll be experiencing catastrophic climate change. All we can do now is imagine how the special relationship Johnson-Trump phone call went. Perhaps it sounded something like this.
Now the Democrats are politicizing the coronavirus. You know that, right? Coronavirus. This is their new hoax.
No, well, Victoria, I can tell you that I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody. You'll be pleased to know, and I continue to shake hands. And
recordings there of Donald Trump telling a rally of supporters that the coronavirus was a hoax, and Boris Johnson joking about shaking hands with COVID-19 patients. I contacted the White House to ask for the President to come on the programme and find out if he still thought the pandemic was a hoax. I was told he was unavailable for comment. I heard this week that Tony Rimmer, a member of the Merseyside Pensioners Association, had sent a letter to Boris Johnson. So I decided to phone him up and find out what it was all about. Anyway, how are you?
I'm fine, thank you. How are you?
Yeah, very well, very well. Wish I could walk down the road to the pub, but unfortunately I can't at the moment.
I'll tell you something, mate. That's the one thing I'm really looking forward to, going to the pub. I didn't realise I went to the pub that often, but just the fact that you can't go,
it makes it more desirable, doesn't it?
As soon as they raise this bloody thing, I'm at the pub door for opening, whatever pub it might be. I'm there for it opening.
I think there's going to be a stampede, isn't there?
Oh, there will. Yeah.
I understand you've been corresponding with the Prime Minister.
No, well, I have. I don't know what the Prime Minister actually said to me to correspond back to him, but I hope if my message got back to him, it was clear. You know, what I was saying to him, I didn't actually open his letter to find out what he was saying. I didn't want to spend any time listening to his lies. I heard enough of them over the period of the general election.
So what did you write back to him?
I just put on there that, £5.7 million to send this, you could have been spent on better things like the NHS or the homeless. What a waste of money, and you're a disgraced. Shame on you. But it was clear that it came from the government and Downing Street, so that's why I posted it back, return to sender, unsolicited, mail. I would hope that when the letter arrives back at Downing Street, they're charged for the postage, because I certainly didn't put any postage on it. To be perfectly honest with you, I'm sick of hearing Tory propaganda and lies. Every time the Tories speak, it's lies, and we've had to put up with it during the general election, and unfortunately people fell for it. So I wasn't prepared to sit and waste any of my time reading what he had to say in that letter. Yeah, we do have to listen and follow the guidance, but I'd much rather listen to the guidance from someone who's a medical person or a scientist than listen to Boris Johnson lying to me again. I just really can't listen to their daily news bulletins when they're out, the three of them are on a rostrum. I just get the feeling when you see them walking up Downing Street and you've got the press all lined up on the opposite side of the road and they're all walking up in little groups of two or individuals where it's the secretaries of state and government ministers and one thing or another, and then you see them disappearing through the doors of Downing Street. You just get the feeling that when they get in there, they don't know what the hell they're doing. You don't know who the hell is going to be leading on what it is they're supposed to be discussing. But unfortunately, it's more likely to be Dominic Cummings rather than any government minister with any sense about them. It's a totally unelected government official who's pulling the strings on all this.
Merseyside pensioner Tony Rimmer. You can listen to all of the Merseyside Pensioners podcasts by going to the Merseyside Pensioners YouTube channel. There's also some films you can watch featuring the campaigning work of the MPA. You can also hear us each week on Liverpool Community Radio FM 106.7 or online. Remember, if you have something to say, then contact me by email at maxwellphotouk@yahoo.co.uk. Finally, we hear from the chair of the Pensioners Association, Julie Lyon-Taylor, who tells us why she is so angry about the way cleaners are treated.
Well, I'm feeling very angry about the cleaning staff because we have been campaigning for them over their pay and their conditions. Now, these have been appalling since there was the privatisation of the cleaning services. And finally, the cleaners have been standing up for themselves, and we as a Pensioners Association have been outside the Royal Hospital in the past supporting them. And that's for a very good reason, because if you think about it, no hospital can exist, no good medication can exist unless the place they're doing it in is clean. It's the foundation of good medical practice, is cleanliness. And these people are the ones that clean all the time. And yet, they are being treated like they are nothing. And yet they are the foundation block of good medical practice. And really, when you think about it, if there was no cleaners to go and do the cleaning, the hospitals couldn't function. And you think about the pay they're getting paid. It just doesn't add up. And I think this coronavirus has actually demonstrated the importance of people who are on low pay. Because if you look around you, generally it's the lowest paid who do some of the most important jobs in society. So as soon as this is over, I think the MPA needs to gear up on social care, what's happening to the care workers, what's happening to the cleaners, because these people are vital to everybody's well-being.
Julie Lyon-Taylor, the chair of the Merseyside Pensioners Association. Remember, we need to demand mass testing now for everyone. We need to demand protection for all our NHS and key workers. And when this is all over, we need to demand justice for all those who have succumbed to an unnecessary death. We need to organise together against a government who breaks the law to kill the poor. No matter how hard they try, they will not be able to hide from truth and justice. This is pensioner Phil Maxwell saying goodbye for now, stay safe, and solidarity to you all.